So now it's my pleasure to introduce to you Lowell Cruz. Lowell is the Communities of Excellence co-founder and chairman. And Lowell retired in 2009 from Heartland Health after serving as CEO for 25 years. In 2009, Heartland Health was a recipient of the Baldrige National Quality Award and also the Foster G. McGaw Prize for Excellence in Community Service. We're very happy to have him here, and it is my pleasure to kick this off with a discussion from Lowell. Thank you.
Hello. If we go to the next slide, as Stephanie said, what I want to do is to introduce you to our thinking about what led us to using the Baldrige Framework, which led us to begin thinking about using the Baldrige Framework for communities. And I'm going to do that by telling the story about Heartland Health in St. Joseph, Missouri, and our 21 county service area, which basically is Northwest Missouri, a little bit of Kansas, Nebraska, and Iowa. So the slide in front of you, for those of you who can see it, and I noticed a couple of you have good background in Baldrige, but for the most part, a lot of you are saying we want to learn more about Baldrige. So we're just introducing this to you today. So you're not going to learn much from me about Baldrige, but why we got to it. So first of all, about St. Joseph in Northwest Missouri. St. Joseph in the mid-1880s was the launching point for the Western expansion. So imagine all those wagon trains backing up 7-8 miles long, waiting to cross the Missouri River to head west. And we built our reputation and our economy on that Western expansion. The dilemma is that at some point, someone suggested, and we were a town of about 70,000 people back in the mid-1800s. Someone suggested we build a bridge to get people across the river, Missouri River, more efficiently. But the people that ran the company that took the people across the river on their barges said, no, we don't need a bridge. So Kansas City built the bridge. So one of the messages is that we're still a town of 70, 100 years later, and Kansas City has a couple million people. But it started with that, and it was a way of thinking about being not as progressive as they needed to. We had some progressive things going on in St. Joseph in Northwest Missouri. Like the Pony Express was trying to get mail out to Sacramento in a very short period of time, but the organization went bankrupt 18 months later because of the telegraph. Then we had the farm crisis, and all the things that went wrong seemed to happen in Northwest Missouri. So the dilemma is I showed up in 1984 as the new chief executive of the hospital. There were 2 hospitals at the time, and we were just putting them together in the form of Heartland Health. And we noticed that we had a lot of issues around poverty, lack of education. We had a tough time recruiting our employees out of the region. And as the slide says, that ultimately about the only conclusion we could come to is that as our Cubs, our new World Series champion, the Cubs came to, is that anybody can have a bad century, but you got to start someplace and start over. So we took the position that as a hospital, we had 2 responsibilities. One was making sure that we did an outstanding job of taking care of our patients, and we weren't doing that very well. And the second was improving the health of the population. And given our circumstance of low educational attainment, poor economy, and a variety of other things, we had a huge challenge. So that's kind of what we were facing and what we understood at the beginning of around 1991, 92, after I'd been there about 5 years. Next slide, please. So we don't have the next slide up yet, but so we continued to do our work at Heartland, trying to figure out how do we improve the quality of what we do. That was our first big task. We did some measuring, comparing with other hospitals in the early 90s, and began to realize that we were operating in the bottom quartile of virtually all measures, whether it was quality or financial performance or what have you. I had learned a little bit about the Baldrige organization because a friend of mine, we came from Rochester, New York to St. Joseph, Missouri. And when I was in Rochester, I met a friend who was a quality officer for the Xerox Corporation. And they began to use the quality principles as they began to turn the Xerox organization around. And ultimately, for those of you that know a bit about Baldrige, Xerox was one of the early recipients of the Baldrige Award. And as my friend and I continued to talk about this quality process that they were using in manufacturing, I began to wonder whether or not we could use it in healthcare. Healthcare had not advanced to thinking about using Baldrige for our industry until about the mid-1990s. But I, through recommendation from a couple people, approached the Excellence in Missouri Foundation and asked them if they could come in and begin to help us think about how we could use the Baldrige framework in terms of a healthcare enterprise. And you'll learn about this a little bit later on, that by the end of the 1990s, healthcare had adopted Baldrige. It was the second sector to be accepted as part of the Baldrige framework, along with education in the mid-1990s, and then it moved, as you'll learn later on, to all other sectors of the economy. So we adopted the Baldrige framework for Heartland as our management model in 1994, 95, somewhere in that time frame. Then came on stream pretty quickly when it actually became part of Baldrige. And to make a long story very short, by just changing the way we manage the organization, literally the same people, not exactly, but the same people that were running Heartland when we were at the bottom of and operating the organization when we were at the bottom of the performance ladder, were there when we were operating in the top 5% and the top 1% when we received the Baldrige Awards in 1990, or in 2009. So the learning for me was that you can dramatically improve the performance of any organization by using the Baldrige principles. We used it extremely well, and I was so impressed with our staff, so impressed with our employees in the way they turned that organization around, what it did for our patients, what it did for our community, to know that that we could accomplish that in Northwest Missouri was quite a remarkable thing in improving the overall performance of the community and the organization. You can see from the slide that's up there now that our service area, I told you before, the 18 counties of Northwest Missouri and a few counties in Nebraska and Iowa. But that was our service. Largely, it's an old population, poor, had all the features of a struggling economy. The next one, please. What we learned once we improved the organizational structure inside of Heartland and the way we performed our clinical outcomes, we learned ultimately, just by looking at the population, that in order for us to really do a good job of improving the health of our population, we knew that hospital by itself wasn't going to be able to accomplish that, which I think all of you are learning. And the reason you're on this discussion is that you have to improve educational attainment. Back in 1984, we were graduating about 75% of our students from high school. By the time we got to 2014, we were having a graduation rate above 90%. It's because the community all came together. So we worked a lot on education and the quality of jobs. We had an unemployment rate of 11% in St. Joseph. Back in 1984, 85, this last couple of years, it's been 4.5%, leading the state in terms of overall job growth. So what we learned is that if we could take all of our employees at Heartland that learned how to operate using the quality principles inside the organization, we began to infiltrate the community, if you will, and basically use what we learned at Heartland through Baldrige. We decided we would use it in the community. That led to the next slide, which was our strategy map. I believe it's, yes, the strategy map. If you look at that, and some of you have seen this before, we're basically borrowing this from the Civic League, who've been using it for decades. But essentially, we're saying that the thing that causes disease, the top of the pyramid, is really the behaviors that cause the disease. But the behaviors come from the human condition that exists in a community. The human condition of stress and anger and poverty and hopelessness and what have you. It's that condition that drives the behavior that causes the disease. If you look at all other sectors, whether it's educational attainment or people that show up in prison or job growth, the human condition drives the behavior that causes people not to graduate from high school. It causes the behavior of people that end up in prison. So there is one point in all of our work, whether you're in school systems or prisons or city government, at the bottom of this pyramid, that we all have to come together as a community to improve the top of our pyramid for whatever sector we're in. After I retired, and several of my friends also in that process that were Baldrige recipients, because you kind of join a community, if you will, we began to talk about whether or not we could take Baldrige, which now covered every strategy, every sector of our economy. Could we develop a Baldrige framework for communities? That discussion started back in 2010 and has led us to this idea of communities of excellence. And we envision long-term that communities of excellence will become the seventh sector, or communities will become the seventh sector for Baldrige. The next slide, please. So we put together a not-for-profit organization in about 2012, 13, somewhere in that time frame, and our founding principle about America, about improving health status, is that you have to improve educational attainment, jobs, all those things. And so we're basically saying for America to sustain its vitality, promote opportunity, create a more equitable society during the next 250 years of our existence, we have to improve the performance of communities and the people who lead and live in them. That is the driving force for our entire work. So our hypothesis is that you can take this Baldrige framework that you're going to all need to learn a bit more about as it applies to your organization, that we can take that framework and apply it to a community that doesn't have a CEO. You have to come up with a different structure, some kind of a governance or leadership structure that actually behaves and does the work of a CEO, but doesn't serve in that capacity as an individual. It has to be supported through people like community coaches, and there has to be a variety of other things in places, what we're working on and what you'll learn about more during this 5-part series. And I think the last slide would show you what the Baldrige framework looks like. And Stephanie, I want Stephanie to talk a bit about this as well, but we've basically taken the Baldrige framework, which is what you see, and changed a bit of the language. Instead of organizational profile, it's community profile. Instead of leadership, it says community leadership. And all of the drill down, all of the language in each of these 7 categories is geared to apply to a community's, the way a community function. So Stephanie, if you want to take just a moment to kind of start to compare those two, then I think we can begin a discussion.
Certainly. So, Lowell touched on a couple of the differences between an organization and a community. The biggest one being that an organization has a CEO that will drive decision-making. And a community, in the way that we're looking at it, doesn't necessarily. So people think about city government, but that's not really what we're focusing on. We're focusing on the people that make your community, your school leaders and your hospital leaders and your business leaders and your informal community leaders, all the people that make up your actual community. So when we envisioned and thought about what community leadership looked like to us, it's a system, it's a systems leadership. So it's a group of people who come together and agree to make decisions that benefit the community, to put aside perhaps their individual organizations' needs, not necessarily all the time, but to work as a community together. And when we looked at community strategy, the businesses have strategic plans. Well, a community as a whole can have a strategy. If you envisioned every single business and organization, church, school, in a community, all aligning their strategic plans together to target specific goals, target specific improvements that community needs, it's a very powerful statement to make. In addition, we thought about who are the customers in a community. You think about, well, the definition we used is they're those who depend on us. They're the people that depend on your community to help you thrive. So that's why you see this title, residents and other customers. And from there, I guess I could probably keep going, but we put a lot of thought into what makes a community successful. What do you need? And you look at community operations, there are processes in a community. And there are best practices that are going on. For instance, right now in San Diego, which is one of our pilot communities, the South region of San Diego, they have some incredible successes. There was a childhood obesity initiative in Chula Vista that had an incredible reduction in childhood obesity. Well, what's important is to look at that process, understand why it was successful, and then help spread it to other communities. And that's a real focus of Baldrige, and a focus of what we're trying to do for communities is to benchmark performance and then spread best practices around. Lowell, do you want to add anything?
Well, I think what's important for everyone to understand is that when we brought the Baldrige organization, the state quality organization in Missouri, into Heartland, they didn't come to take over the operation of Heartland. They just came to help us improve our performance. And we see communities of excellence using the Baldrige Framework just as exactly that. We want to help, well, no matter what system a community is using, how they think about themselves, whether it's collective impact or a healthy community strategy or rethinking health or whatever you have going on. We're not trying to replace that. We're not trying to become another initiative like that. We're simply trying to help make sure that they're as successful as they can possibly be. And that's what Baldrige was formed around when they started back in the late 80s, helping large manufacturing sector improve their performance. And when they moved to health and education, it is simply to improve the performance of all the organizations that exist. We've got a lot of people working very hard in communities all over the country. We just want them to be more successful. And we believe applying the Baldrige Framework to that process will make that happen.